Hello and welcome to the Tech Geek podcast. I'm your host Sukriti. Thank you so much for tuning in. Digitization has unleashed a flood of clinical and medical data that presents a huge opportunity in healthcare. However, it can be overwhelming for clinicians, nurses, and administrators. Therefore, only raw data isn't enough. Healthcare leaders must know how to turn powerful insights and information from the same in real time to make informed decisions. Healthcare informatics leaders are putting their trust in digital technologies and data to achieve their hospital or healthcare facilities goals. But how is this all being done? How leaders in health tech are using the informatics to achieve transformative potential? Well, to know this and much more, today I'm in conversation with Arvind Vaishnav, Vice President, Head of Philips Innovation Campus, Bangalore. Welcome to the show, Arvind. I'm so excited to have you here for the show.
Thank you, Sukriti. Equally excited to be a part of this discussion and show. Uh, Very happy to interact on a topic which is very near and dear to, I guess, all the healthcare providers. My name is Arvind. I head the Philips Innovation Campus. I have been in Philips for about 12 years and have spent close to about 27 years in the healthcare domain. So, with the current trends, which are all going in the healthcare industry, this is a wonderful topic to have a conversation. Thank you for inviting me.
Thanks, Arvind. Without any further ado, I will quickly jump to the questions. I can't wait for you to share the insights that you have right from knowing about healthcare informatics to how it exactly, being adopted and it's being working out in the industry altogether. So to start with, what is the role of healthcare informatics in today's time?
Yeah. So before we directly look at the healthcare informatics, let us start with what is the challenges or what are the trends that we are seeing in the healthcare industry today. I want to start with that. Obviously, we all know and we have gone through the post-pandemic, pre and post-pandemic situation. One of the biggest change that we are seeing is healthcare is extending beyond hospital walls into home and community. Now, that's one of the biggest shift that we have seen, and I'm sure this shift is going to continue from here on. What does it mean for our healthcare providers? The healthcare professionals, due to this, are under tremendous pressure, and the pressure is largely coming from improving the productivity, dealing with the staff shortages, and have the better clinical outcome for their patients. So that's one area that the healthcare providers are dealing with today. But when you look at the patient into the center of this, patients are expecting the most convenient way of getting the healthcare. There is a lot of digitization that they are experiencing around it. All of us are experiencing around it. And I think the patients are also now expanding their expectation to experience a similar kind of a digital experience even in the healthcare as well. Now, what does this mean? This means that every healthcare professional will have to work on creating an enterprise-wide strategy to address these challenges. They are looking at end-to-end data integration. They are looking at driving precision across the continuum so that they can drive the patient outcome in a better way. But the challenge with the data is it's a very fragmented and it's in the silos. Interoperability within our hospital network is another big challenge. Now that's where addressing these challenges, the role of informatics comes in. Uh, with a focus on healthcare professionals caring for their patients, they are leveraging technology to generate meaningful insights from the available information, or call it as the data within the hospital. And that's where I see a big role. The informatics will continue to integrate the information which is available in the hospital, be it imaging, be it in the digital pathology area, be it in genomics area, be it monitoring and therapies, be it in the informatics area, because that will liberate and connect data for clinical confidence and productive insights, which will make the operations even more efficient. So I see a very big role of informatics coming into the play with streamlining, generating insights from all the data that is available, bringing it into a common platform, make the interoperable solutions, and make the healthcare more efficient for their patients.
All right. So, Arvind, this was about the informatics part and the role it is, actually playing out in the industry these days. We also spoke in the very beginning. When I was setting up a pretext of this conversation, that technological adoption is one of the most important angles, which is being used as a potential here, and AI being one of them. How do you see the adoption of emerging technologies like AI in healthcare informatics?
Yeah, before I say that, since you talked about the adoption of the AI or informatics solution, I generally feel that the adoption for the informatics solutions has been slow in the healthcare, and that's largely due to the privacy and the patient data safety challenges. However, I think this is changing very, very rapidly. People are seeing the value of the informatics solutions as in such as AI, and there is a lot more openness now for the adoption. Now at Philips, we believe that the value of AI in healthcare is going to be only strong if they are built around the people centric, be it patients or be it customers. We do believe that there has to be a human experience behind the AI to support it and get the maximum output that we expect from the AI models. Now, uh, there are examples which are already being created, which talks about diagnostic to acute monitoring and self-management to the chronic diseases. AI has started to prove and shown a strong potential to support healthcare providers. Um, that we strongly believe that if AI models are integrated into the workflow of healthcare professional as well as in people's daily routine, it will have a maximum impact, both in terms of adoption and improving the outcome. So in short, slow adoption because of the privacy, but that's going away. And then the AI and informatics should be centered around the people. It could be healthcare professional and or to the patients or to the consumers.
Okay. So, the informatics in healthcare is enhancing productivity. But how exactly it is being done, Arvind? And is it addressing the challenges like shortage of healthcare professionals in the sector right now?
Um, Yeah, I mean, as I just said, that the staff shortages is one of the biggest challenge that we face currently, and obviously the technology is the one that should address that. Now, one of the biggest thing that comes to my mind is when I see the healthcare professional, they are ramping up their investments mainly in automation area and AI. Both of these are heavily driven today to alleviate the pressure on the staff and to empower them with more predictive insights and the clinical decision support. I think these are very powerful uh, areas which can empower the healthcare professionals to provide better insights or to generate the better insights at a much faster pace because of the informatics solutions. And mostly the younger healthcare professionals are really eager to embrace the new digital technology, and they really consider it as a key factor when coming and adopting to the work. And we can also relate this to ourselves. We are all consumers of health services, and we are also consumers of we have the we also experience ourselves as a patient. And so we could realize that, this is how our address going to be from the industry standpoint.
Okay, so that being said, another important concern that is being raised is about data privacy and security altogether, and all of us know how crucial it is. It has become in today's time, and everyone is concerned. People are concerned about the data privacy and security now more than ever, since our data is being collected at an unprecedented rate almost everywhere. Now, how can companies ensure robust data security and transparency?
Yeah, earlier I talked about this has been a challenge, but this is, I would say, fading away. I think there is a sensitivity around the companies, the healthcare professionals, everybody. They are looking at addressing these challenges. Uh, I do believe that the comprehensive information around the security requires focus on three domains, whether it is people, process, and technology. Those are the three areas to be focused. At Philips, From an information security implementation perspective, we are putting controls largely in three areas or three domains. One is confidentiality. So as an example, only those who should have the access to data should have that access to data and retrieve it if it is required. So confidentiality is one. Integrity, which also means that information cannot be modified or changed without its detection, right? So that's the integrity piece. Availability, information can be assessed when needed, not not that this vastly available patient information that is being shared across the board. So it should be available to those who have a purpose to it, those who have a use to it, and then they have a consent to it. And those are the three areas where we are putting our efforts and energies. We'll continue to obviously evolve and work through the landscape of secure enterprise information systems. And that obviously will increase the customer trust in Philips. The Philips security information continues to focus on investments on retaining cybersecurity, talented people, right toolings and capabilities, and integrating security best practices in all our businesses and all other work that we are doing. We do believe that this is we as a healthcare professional have a tremendous responsibility to it, and we'll continue to up our efforts and games as we go along through the informatics journey.
All right. Now, coming to the last one here, we should definitely talk about what the trends should be in the coming years. What do you think? What trends do you foresee in the health tech sector in the coming years, Arvind?
Well, I think you already talked to me in a second question about the artificial intelligence. I think that's going to be the biggest trend.
Okay.
Uh, that's going to be a very big game changer. Of course, I do feel that if we have to have the big change that needs to be driven, as I talked about, number one, it has to be people centric. Number two, the companies, healthcare professional, all of us need to pick up the right use cases to deploy AI into our practice. Um, Computer vision, natural language processing, the pattern recognition algorithms are already deep rooted within the healthcare systems, but we continue to adopt them going forward and deploy them to the practical situations, which I call them as the use cases, to really have the right examples to set around. So that's one big trend. I think the another big trend is going to be predictive analytics. That again, we touched in our topic. There is so much of healthcare data that can be leveraged for generating the right insights. And only when we have the right insights, we can have the information, pass it on to the right stakeholders. Look, data is just data. Only when we build insights and analytics on that, then it becomes meaningful. So I think the data analytics, predictive analytics, especially in healthcare, is the next big area which will continue to be the focus. I think uh, we started this conversation with the backdrop of pandemic, which of course is the past, but had a major impact on the healthcare delivery. I do feel that remote patient monitoring, looking at patients outside of the hospital walls and monitor them, is another trend which will continue to exist. I think there is no going back on the practices and the experience that all of us developed during the COVID time. I think it will become even more. So I think making it more convenient, making it more accessible, making it potentially cost saving for our patients, those will be some of the areas where remote patient monitoring will come into the play. Obviously, I can talk about, but this is my last point from a trend perspective. I can talk all of this, but talking about cloud in the healthcare, that's also going to be very, very important trend. I think more and more solutions, informatics solutions, more and more decision support will continue to be leveraging the cloud computing as a technology. Obviously, it is of a lower capital and operational experience expenses, so it's a benefit for our customers. But it will also increase the efficiency of the care providers in terms of overall delivery of the healthcare. Connected to with that cloud, I we have to talk about uh, the software as a service. That's another one area. Paper use as in services that we see, and those will continue to rise as we go along. One last that I will talk about as a trend is interoperability and data integration. I think the informatics area, the biggest play is to make sure that we have the data interoperability in the hospital. Today, there are multiple places where the data is kind of scattered. I think companies, all of us, should continue to put our efforts in making sure that there is a tremendous amount of efforts in bringing data to one source. And that's what I talk about, the interoperability and data integration across the multiple services within the hospitals. Last, not the least, I think at Philips, our purpose is to improve people health and well-being through meaningful innovation. And I think the trend that for all of us is keeping the patient in the center, making sure that they have the best experience, because that's where the trend is going to be, and we should continue to do that. So those are my 4 or 5 big top of the mind recall when we talk of the shifting trends in healthcare.
Thank you, Arvind. I'm sure Philips is actively creating and deploying the healthcare informatics solutions, for various things that they're trying to look at. And as you mentioned about the future, AI coming into the play and helping with informatics in a much more larger way. And we're putting in our trust into these digital technologies to achieve the certain objective of improving the healthcare facilities and the goals for everyone around us. So thank you so much for being here with us on this show and sharing these insights with us, Arvind.
Well, it was great to talk to you, Sukriti. It is, as I said, it's what you are picking up is a topic which is in the center of the healthcare. And so thank you very much. I think what we all have gone through with the pandemic and what we have started on a journey, I do feel that this journey will continue and even will get better and better in the interest of our patients, consumers, as well as customers. So thank you for inviting me on this show.
Thank you so much, Arvind, once again. Audience, I hope you have had a great time listening to Arvind, who's heading the Philips Innovation Campus at Bangalore, and he's given us an insight onto how useful AI is going to be, what are the health informatics, the system altogether is being worked out, and I'm sure your field of interest would be something that would definitely have an objective of improving healthcare. So thank you so much once again, everyone. I'll be back with another tech podcast very soon. Till then, stay safe and take care. Thank you so much.